Welcome to The Bee's Knees, a podcast full of articles, interviews, clinical studies, and advice about knee surgery, physical therapy, and life after knee surgery.
Welcome to The Bee's Knees. This is PJ Ewing, your host, and we are on the 6th day of 7 with our podcast a day series of small, short, important interviews that will help us all understand what's going on in the knee during knee surgery and recovery. Today we have Dr. Michael Moon, a pathologist from Michigan, who is going to take us through the whys and hows of scar tissue at the cellular level. He's going inside the knee, looking at what's happening with the body when vessels are broken and the body is disrupted with surgery. How does the body deal with it at the cellular level? Just a little bit about Dr. Moon before we listen to his comments. Dr. Michael Moon is a pathologist in Rochester, Michigan, and is affiliated with Ascension Crittenden Hospital Medical Center. He received his medical degree from Wayne State University School of Medicine and has been in practice for more than 25 years. So, with that said, let's listen to Dr. Moon and his comments about recovery at the cellular level.
After surgery, you have a number of changes that take place, all part of the normal reactive, reparative process. These types of changes take place with most any trauma or injury, whether it be to skin surfaces or deeper. These changes are induced by a variety of factors that act kind of in a cascade formation, in a cascade manner. After injury, there are a number of different types of cells, some of them inflammatory cells, some of them cells such as fibroblasts, macrophages, lymphocytes, that are drawn to the area of injury simply by the processes of injury to blood vessels. The blood vessels have cells in them that release products when they are injured, that draw these cells to the area, that institute then reactive or reparative processes. These involve normal clotting mechanisms, inflammatory processes to guard against infections, and processes to repair the damage that's been done. A lot of this is done by fibroblasts. Fibroblasts lay down collagen and thereby repair some of the damage that was done by an injury, or more specifically in this case by surgery. Now, this is a good thing. You have to be able to repair the injury. However, the tissue repaired isn't the same as the natural tissue. It's predominantly collagen. It is more cellular than the normal tissue because you now have all these other cells there that weren't there in the past. In the pre-injured tissue, you have fibers other than collagen, particularly elastin. Elastin is elastic. It allows movement a lot better than collagen is.
So let's break that down just a little bit. Dr. Moon talks about all kinds of cellular activity that's dealing with preventing infection, dealing with swelling, dealing with the breakdown of the blood vessels, and helping to manage the body after surgery or injury. And the intention is to stabilize, repair, fix what's happened. Now, the problem that he mentions, if you heard clearly, was that the body before surgery, before injury, has lots of elastin in these areas that are going to need work or need help. The elastin is not recreated. There is no new elastin, only collagen. Collagen is not bendy. It doesn't move like it used to. The body does not build this new elastic tissue. Rather, it builds a strong, tough, fibrotic collagen that is now in place of the elastin. So suddenly the body is, since it's unable to build what we had before, there is a tendency for this to be less pliable. And that's the essence of what's happening and what we have to deal with after a knee surgery. I hope that came through in his comments. Listen to it again if you didn't quite get that. There's a subsequent interview with Dr. Moon that we're going to publish tomorrow, next in our series, the final part of our 7-day series, that would be also worth listening to because it discusses that really tough, gnarly, hard to deal with scar tissue and also a thing called a keloid or keloids. So what I really wanted everyone to know was that there is a different kind of tissue that is created by these cells that are repairing, and that is different and tougher to deal with than what we had before surgery. And with that, thank you, Dr. Moon, for that wonderful explanation. Listen to the next one, listen to the past episodes. Like on our podcast feed if you have the inclination, make a comment. We welcome all your feedback. If you want to reach out to us directly, you can reach us at thebeeskneespodcast@gmail.com. If you want a whole bunch of really good content about knee surgery preparation or recovery, go to x10therapy.com, where if you just go to the blog bar or do the search bar and search a topic that you're interested in, you will likely find something of value, as well as other stuff that you may not know about. So thanks for listening. I'll see you again next time.
To learn more, visit x10therapy.com, 1-855-910-5633. Just a reminder, it's a huge help if you subscribe to, rate, and review our podcast. It helps people find us.
X10, back to full strength.